Hi, my name is Rochelle and I'll be your nurse today. I'm going to be performing a complete physical assessment. Is that okay?
Yes.
Okay, if you feel any pain or any discomfort throughout the entire process, please let me know.
Yes, ma'am.
Alright, can you tell me your age?
13.
And what is your name?
Gabrielle
And
Richard.
what is your date of birth?
February 7th, 2002.
Okay, so this is Gabrielle. She's 13. She's a young white female. She's awake, alert, oriented to time, person, and place. She speaks English. Her words are well formed. Her speech is clear and age appropriate. She's very well nourished. She's very pleasant and has good hygiene. She is currently sitting up in a chair with good posture, and she's sitting in the chair unassisted, and she has no obvious physical deformities. She is able to walk unassisted without any devices, and she has good gait. Alrighty, Gabby. So we're going to be doing your skin, your head, your face, and your neck assessment. We're going to start off with your skin assessment first, okay? Can I have your hands? Alright. And what I'm checking for is any lesions. I'm checking your temperature, your color. I'm going to get you to turn your hands over and for any sweating. Alright, so now I'm going to be checking for any needle marks or any cat scratches. Okay. Alright, so can you turn your hands back over? So I'm going to check your capillary refills, making sure they're less than 3 seconds, which means you have pretty good oxygenation. Alrighty, so I'm going to get you to squeeze your hands. Squeeze as hard as you can. Good. Okay. I'm going to get you to put your fingers together, and I'm checking for nail configuration. Okay. Good deal. Alright, so now I'm going to check your pulses. I'm going to check your peripheral pulses first. Okay, and then your brachial pulses. Okay, so now I'm going to check your head and your face. First, I'm going to check your scalp and your hair. And what I'm checking for is any lesions. I'm checking to make sure your hair is evenly distributed, your texture in your mouth. Okay. Alright, so now I'm going to be checking cranial nerve number 7, which is your face. I'm going to get you to close your eyes for me and open and raise your eyebrows, both eyebrows. Good deal. Okay, can you open your mouth and smile and show me your teeth? Alrighty, so now I'm going to check your temporal arteries. Okay, and now I'm going to check your TMJ, which is cranial nerve number 5. Can you open your mouth and close it? Good. Okay, so I'm going to check your sinuses. If you feel any pain, please let me know, okay? I'm going to push, and you tell me if you have any pain. Any pain?
No.
Okay. Any pain?
No.
Alrighty. So now I'm going to check your neck. I'm making sure your neck is symmetrical. I don't see any visible pulsations, and I'm checking for any lumps. So I'm going to start off with checking your lymph nodes, okay? So the first lymph node we're going to check is your pre-auricular, and then your post-auricular, and then your submaxillary, and your submental. Okay, so now I'm going to check her occipital node, and then her anterior superficial cervical chain, and then her posterior cervical chain. And now I'm going to check your supraclavicular nodes. Can you raise your shoulders up just a little bit for me? Alrighty, good. Alright, so now I'm going to check your carotid pulses to make sure they're equal and they have good pulses, okay? Good. Okay, good. Now I'm going to listen to them. Okay, so now I'm checking for cranial nerve number 11. I'm going to get you to push your head against my hand as hard as you can. Good. And then do same as, alright, good. So I'm going to put my hands on top of your shoulders and I'm going to get you to push against me, okay? Raise your shoulders and try to push against me. Good. Okay, so I'm going to place my hands on your side and I'm going to get you to try to push out. Alrighty, good deal. Okay, so now the next assessment is going to be your eyes. I'm going to be checking your vision and checking your peripheral vision. And if I see any abnormal, if I have any abnormal findings normally, that means it's indicative of some kind of stroke. So it's cardinal fields of gaze is what we call it, and that's cranial nerve number 3, 4, and 5. So what I want you to do is the entire time I check for your eyes, I want you to keep your head really still, okay?
Yes.
Okay, so I want you to follow this pin to wherever it goes, okay? But don't move your head. Okay, so now I'm checking your external eye structure. I'm checking your eyebrows, your eyelids, and your eyelashes, and I'm just checking for any drainage, any signs of infection, any crusting, okay? Alrighty. Okay, so now I'm going to check your conjunctiva of your eyes. I'm going to pull down on your eyelids, and when I do that, I want you to look up at the ceiling, okay? Alright, good deal. Okay, so next, I'm going to check your sclera and make sure it's smooth. I'm just going to shine the light in your eyes. I'm going to do the opposite side. Alright, so now I'm going to check your pupils. I'm going to make sure they're equal, round, and reactive to light, okay? I'm just going to shine your light and I'm going to move it away really fast. Good. Okay, so now we're going to check your ears. I'm checking your external ears, checking for any lesions, making sure they're symmetrical, making sure they're even on both sides of your head. So, and I'm going to check for any tenderness, which would normally be a sign of some kind of infection. When I pull up on your arm, tell me if you have any, on your ear, I'm sorry, tell me if you have any pain. Any pain?
No.
All right. Any pain?
No.
Good. So now I'm going to check for cranial nerve number 8, which is your hearing. I'm going to say a word, and I want you to repeat it back to me, okay?
Baseball.
Good.
Baseball.
All righty. Okay, so now we're going to check your nose. I'm checking your external nose. I'm checking for any lesions, making sure it's symmetrical and even. Alrighty, so now I'm going to do your smell test, and that's going to be cranial nerve number 1. I'm going to get you to close your eyes. Can you close off your right nose for me? Okay, and then smell for me. And what does that smell like?
Coffee.
Okay, keep your eyes closed and switch fingers. Close off your left. Good job. Okay, can you smell? And what does that smell like?
Coffee.
Alright, so now I'm going to take the flashlight and I'm going to be looking into your nose just to make sure it's not swollen, it's patent, it's open, and it means you're able to breathe well. Can you look up at the ceiling for me? Good, and I don't notice any redness or any lesions inside or any sores inside of your nose, okay? Alright, so I'm also checking her mucosa, which is the lining of her inside of her nose. And then also, I'm checking her septum to make sure it's not deviated, make sure it's straight and even line. Alright, so now we're going to do your mouth and your lips. First, I'm going to check your lips, making sure there's no cold sores and there's no redness, no swelling, no dry lips. So I'm going to get you to open your mouth, and I'm going to check your mucosa, which is that lining of your mouth. Can you open your mouth just a little bit wider for me? A little bit wider. Okay, good. Okay. Alright, so now I'm going to check your teeth and gums. Can you put your teeth together? Say, good. And what I'm checking for is make sure they're white, there's no sharp objects, no sharp teeth, and then it's free of debris. Alrighty, so can you stick your tongue out for me? Lift it up. Good. Okay, stick your tongue out one more time. I'm going to check your hard palate. Okay, and then your soft palate. Okay, so now that that's done, I'm going to be checking your tonsils. Okay, can you stick your tongue out for me? And say ah. Where is, there it is. Okay, one more time. Stick your tongue out. I'm going to push down on your tongue and say ah. Okay, and I'm making sure I'm checking your uvula, which is cranial nerve number 9 and 10, and I'm checking to make sure your tonsils aren't swollen, and the back of your throat is not red or inflamed, or you don't have any sores in the back of your throat. Okay. Okay, so I'm gonna get you to check. I'm gonna check your tongue and your tongue muscles. By that, I'm doing to check your cranial nerve number 12. Can you stick your tongue out, and then pull it back in? Stick it out. Turn it to the left. And then to the right. Alright, Good job. Okay, so now I'm going to check your thyroid glands, okay? I'm going to get you to sit straight up. Okay, and then slightly put your head down. Good. Just raise your head just a little bit. There, okay. And now I'm going to get you to swallow. Okay, good. So that is the first part of our physical assessment.